So what challenges still exist in using AI to like fully harness like the power of big data for like personalized treatments? Because this obviously, like we touched on, it is sensitive, is obviously it's massively impactful, isn't it? If it's not handled correctly. So
Yeah.
what are the key challenges that are still assisting to like, I guess, adopt massive change?
So for the adoption, if we now move a little bit away from research more to the translation into the routine care, it is certainly the implementation into the clinical workflow. So look, if you have a good algorithm that can support physicians, for example, in deciding what is the best innovative treatment for a patient, then even if it's very good and you go to the physician and say, here, look, I do have this app. You just need to enter the patient's demographic details, some symptomatics, some previous treatments, and then it will give you a good recommendation. It won't work. It won't work. I think because of two main reasons. The first one is today, healthcare and also the times at the clinics, at the physicians, it's so busy, it's so crowded, right? Per patient, the physician has a couple of minutes time. And during the time, when did the physician last time really look into your eyes and listen to what you said? They don't have the time. They are constantly busy with taking notes, with reading notes, and it's because everything is getting so much focused on the whole documentation around it. The physician comes in, he writes down, what are you, I see, that's it. If you now should have an additional app on top, re-enter the data, look at it, it's not going to work. So the systems need to be integrated very smoothly into the routine, so that within the system, it can drag out all the necessary input it needs and do a recommendation within the same software, not a second software, because the physician does not have the time to open up a second software. So this is number one. And number two is also a certain explainability to build trust on the algorithms. If I give you this and say, Ben, here, look, it's a fantastic tool. It will work, promise you. I have no clue how, but it will work. You won't use it. At least not in the beginning. Having a certain explainability angle to it, using Shapley values or whatever, it will certainly also accelerate adoption of those tools into the workforce. But speaking about overcrowded systems, I think number one use case where AI will have a substantial impact on our healthcare system is exactly on those documentation tasks. It will, first of all, not be the super fancy diagnosis tools or recommendations and all that. It will be things like speech to text, that the physician can talk to the patient again. Someone in the side is taking notes, structuring those notes, distilling them. In the beginning, when a physician is going to a new patient, it gives a 5-bullet summary of the last 3 visits. I think these are very, let's say, from technology point of view, simple, yet powerful and impactful solutions that will bring us way forward.
Brilliant experience. Like you want to keep improving efficiencies because, like you said, this doctors, everyone, especially in healthcare, it's just so busy, isn't it? If you can minimize everyone wants to save time, don't they? If you can save time, that's just going to create massive gains.
Absolutely. And don't get me wrong, it's not because the physicians do want to do this documentation, it's because they have to. Right. They would love to spend more time talking to me, to you, to all their patients, because I think in addition, this is also what they are trained for. This is where they bring a massive value add. Right? It's just the way a patient tells her story to the physician, the time points where the patient is pausing these are the little hints that enables physicians to do way better job in diagnosis as some rule-based systems.